Thank you, Mr. Chairman. Ms. Gallagher, I want to follow up just very quickly with the discussion that you were having with Senator Hassan regarding this latest news with the weakening of the DEA enforcement authorization. A big expose this weekend through 60 Minutes, Washington Post. You have a drug czar that is now effectively withdrawn from this position. The president himself is saying need to look into this and to investigate it. One of our colleagues on the other side of the aisle has already introduced legislation that would repeal it. There have been some that have suggested it needs to be modified. You've indicated to Senator Hassan that you think that the judge had misinterpreted, or you disagreed with the judge's interpretation, I believe. But do you think that that what was passed in 2016 is actually good and sound, or do you believe that, in fact, given what we know today, that it might need to be modified or amended in some way?
Thank you, Senator. First, let me say Senator Hatch and White House, who authored that bill in the Senate, worked very closely with the DEA to ensure that the bill did not inhibit the ability to take action against registrants. DEA did not oppose that bill. Also, regarding the ALJ's article, which was a draft, I understand, ALJs are not involved in issuing immediate suspension orders. They are recommended by DEA staff. They are issued by an administrator or a deputy administrator.
But do you think that something needs to be done to address what clearly has come out to be limitations within DEA's authority that we might need to address through legislation?
I think that it should be explored as to what DEA's limited actions were and their limited involvement with collaborating with industry and talking about defining the terms that registrants operate under. We have pages of questions that we have submitted to the agency over the years that have gone unanswered. This bill, from our understanding, is sound, and we supported it, but we are open to talking through those issues more closely with you and with other offices.
I do think that it is an issue that has really risen to perhaps a higher level, given what we are seeing around this country with regards to just the ease, the availability of these opioids that are just ravishing parts of our country. So this is something that needs to be continued and addressed. I've listened to the testimony from each of you, have read through your written comments, and I just have to express the frustration that I think the general public feels in just being so limited in their ability to understand why. All they know is that the most expensive part of their health care that they can see is what is going on with the cost of their prescription drugs. And then when we talk about, well, all we need is transparency, but if you look to try to understand it, you've got a manufacturer that sets a list price, but almost nobody pays that. You've got the PBMs that negotiate different prices. You've got the GPOs who might negotiate different prices. You've got one hospital that might charge something different than a hospital across the street. There may be rebates, there may be discounts, there may be other pricing things. There is no way that anyone can follow this. And for the average consumer, if you all are talking transparency, it doesn't mean anything to them. So I look to ways that we might be more transparent, that actually could translate to something. We put on the back of any product what the ingredients are and how that's allocated out. When Alaskans get a permanent fund dividend, it actually lists on that voucher, if you will, where all of the associated costs are attributed to. Are we crazy to think that we could be doing more with actually accounting for the cost so that the consumer could better understand and make it legible? Because right now, it's impossible to understand. And even those of us that are listening to you as supposed experts, it's all Greek, and we're not doing anything to help the consumer. So maybe it's a rhetorical question here, but I challenge you all to translate how the pricing mechanisms, who gets discounts, who doesn't, why it's fair for one hospital to charge something that the other one doesn't. In no other industry that I can think of do you have this latitude for a discrepancy in pricing and the ability to just set it and be done with it. I'm over my time, so perhaps if you can respond to me with some concrete examples of the ways that we can be more transparent, because I think that ultimately that can help us push down the cost. But right now, it's impossible to discern.
I'd like to ask the witnesses are welcome to respond to the senator in writing with concrete examples. I think that'd be helpful to her and all of us.